Hi guys, if you are a patient who has Parkinson's disease or you are a rehab therapist who deals with Parkinson's disease for your clients, stick till the end of the video to find out all the exercises that you can do. Welcome back to Basically Physio guys. Today we'll be exploring rehab for Parkinson's disease. Okay guys, the first thing that you should do is to classify the Parkinson's disease according to the early stage or the advanced stage. A common scale that we use in Parkinson's disease is the Hone and Yahr scale. This Hone and Yahr scale can be actually described in simple words, and that's what I'm going to do for you. In the early stages, the stage 1, 2, 3 of Hone and Yahr scale says that there will be some mild symptoms on one side of the body, all the way to stage 3 whereby the balance and stability is affected on both sides of the body. So for the advanced stage, the Hone and Yahr scale is 4 and 5. And what happens here is that there will be more difficulty in doing the ADLs, activities of daily living, and there will be assistance required for most of these tasks. At stage 5, the patient or client will likely be bed or chair bound. Coming to the early stage of Parkinson's disease, the aim of rehab here is for restoration of functions as much as possible. The evidence here is strong for resistance training. Examples include leg press, chest press, or squats. Another example is aerobic training, whereby you can walk for long distances on a treadmill or just over ground at moderate to high intensity. So for example, you can do this at about 60 to 85% of your heart rate maximum. And next thing, for strong evidence, is external cues training. Cues include rhythmic cues, verbal cues, visual cues, and attentional cues. So you can incorporate this into functional training, resistance training, or aerobic training to maximize the use of these external cues. Next 3 things to do is to establish an exercise routine for your client or for yourself, and to actually look into whether there is a postural hypotension and try to solve it either via reporting it to the doctors for medications or just exploring counter maneuvers and making them physically stronger. Lastly, one of the most important things that you can do during gait is to address the freezing of gait. This will help to reduce the risk of falls. For the advanced stage of Parkinson's disease, the rehab aim here is for skilled maintenance. Examples of interventions will include maintaining the range of motion in the upper limb and lower limb so as to reduce the chances of contractures developing. Next is you would want to support exercise where possible, and this will include planning out a physical activity routine for your client or for yourself so that you have more chances to mobilize out of the bed so as to reduce the complications from prolonged bed rest. Next, you would want to correct the positioning of the patient or your client or yourself in when you are lying down or sitting down for long durations. Next thing, the most important one is to do some caregiver support and caregiver training, because these are the people who will be with your client or your patient for most of the time. When it comes to Parkinson's disease rehabilitation, one important consideration is the timing of medication. So when a client or patient starts to take medications for Parkinson's disease, there will be this thing called on and off time. On time is basically the period of time whereby the symptoms are low, and off time is whereby the symptoms are high. And you would want to actually do your exercises during both this on and off time, but more so during the on time so as to maximize the benefits of the medications. So this is one of the important things that you need to consider for yourself or for your clients when you are doing rehabilitation. So here's the summary of the exercises and rehabilitation guidelines. So you can actually pause the video here or take a screenshot of this video. Once again, thank you for your support for Basically Physio, and do consider to subscribe if this information has been beneficial for you.